I went into medicine really to take my scientific background of what I had been researching and doing for 5 years and try to parlay that into patient care. I've always been a people person, and I really wanted to be able to take care of patients. In the cancer world, it's so important to be able to marry science and patient care. And with my background, that's really what I ultimately did. And so I really went into it just so I could take care of patients. And I drew off my experience at home with both my parents having my mother having breast cancer, my father having lung cancer. And, just going through that as a family member, I take that into it. And that's really, I think, the driving force of what ultimately made me go into medicine. And so for me, I always like to take those experiences and say, hey, I want to treat my patients the same way that that we wanted to be treated as a family and as patients back when I went through that. So I've really kind of always approached it that way. And I always want the patient to feel like they're loved and that someone cares about them. The bonds that you form in oncology are, to me, different than anything else I ever experienced with any of my other rotations. So literally, when I was in medical school and in residency, I sort of went into it knowing that I thought I wanted to do oncology. But as I rotated through the different fields, while I liked some of them, the truth is those bonds with the patients, they're lasting, they're deep, and just caring for oncology patients to me was different than anything that I experienced in any other rotation. I think medicine is a service-oriented field, and the patient is what you're looking out for, and you want that patient experience to be as good as it can be. When I first went into practice, I had sort of a three-word motto, and that was faith, hope, and compassion. And so those were printed on our infusion wall, and I really did that because that's how I see it. And I think if you keep those three things in mind, the patient is going to really have a better experience, and it's going to deepen those bonds. All of those things come into play, and so that's how I've always approached my position and my career and my interactions with patients.